The Western Cape Premier Alan Winde is hosting a digital press conference where he's providing an update on the health platform and vaccination program in the province. Let's take you live to that briefing.
Even before that, which is you can't even transplant that kind of an intervention to other areas. We know how the Minister for Education feels about disrupting an academic time. I'm not saying that Overbeck was using that, but generally where you find that you will not be able. Look at now what is happening in Cape Agulhas around the fishing area. You'll find that there is some concern about that community, and also even some parts of the Swellendam, if you recall, when we had cluster outbreak. So overall, they did very well, but at the same time, you must understand that we don't want to leave behind some of those vulnerables, in as much as that they might be minorities. Now, the question is about how come that you cannot probably use and transplant those to the other settings. In other settings, like in Garden Route, Moselbaai has got a highest demand of the over 60s for the vaccination. Recently, I was there where we find that the people from like the Hatties, Hattenbos, where we find that they've been queuing, the Almeida, where they've been queuing, although it's a town hall that services more than 5 other areas. But because of a vaccination equity that you need to apply, you don't want to provide all of them within the Moselbaai, only around the town hall or the Almeida, and then you leave behind, like, for example, the Grootbrak or what is the other one? I can't recall the other one. Similar, because these are for the Garden Route, you don't want to leave behind the Canaland. Therefore, you have to make sure that you balance, but at the same time, you don't dampen the spirit of those who want to have more. But you look in terms of the approach for the Moselbaai. For Moselbaai, for them, they even use their ratepayers association and also all other platforms in order to create that demand. Look at the Central Karoo, where I'm going to now. You find that it becomes difficult because the anti-SARA, they not only don't have an access to know what is happening in the world, because there's even no actually network there. And the only person who might be able even to, and there are many farms as well, big ones. So it means that you need to work closely with a community leader who has got the key to unlock the gate in that farm. Because in as much as that you may have, which is the team, what they've done, they bring as many of them mobile there. But because it's a gated community, and even if the gates are open, maybe you get the Omfriki to open the gate. But the distance from where Anti-SARA stays up towards the gate, where you wouldn't be able to get inside with Ama Mobile, it becomes a challenge. So that's why we have to come up and see how we balance this. In the Weskus farming community, thanks to Mr. Billy Klassen from the NPO of the Farm Worker Community Development, who knows every farming communities in most of these, not only from the Bach River, but in as far as the Matsekama, who will know that someone died COVID-related, and then will make a noise about let's go and vaccinate, and let's go and test as many people. So there's no one size fits all. It's a similar thing in regard to the Mitchell's Plain in Khayelitsha. In Khayelitsha, it's not necessarily the older persons who have got vaccine hesitancy, but it's mostly my age group, because they are talking about the issues of the infertility, and mostly it's women. Whereas in the Mitchell's Plain, we'll find that the influencers might be the community leaders who are holding influential and holding decision-making powers, like the pastors, and other religious fraternity, and the GPs as well. And the GP, who might be the GP for all the generations in that household. So they find that they see them as the only truth on authority on the matters of the health. So that's how things are. In regard to the documented and undocumented, noting even prior COVID in South Africa, the foreign nationals who have got refugee status and asylum seekers, they are being treated like South Africans by default anyway. So meaning that even for the COVID, because they are documented, by default will be treated similar kind of. The challenge is it was about anyone who's undocumented, be it a South African, which is we've seen the case of the homeless. Actually, even in the informal settlements, we get some people who don't even have a documentation, who have never had a documentation, not only in the Western Cape, because I also hear from my colleagues from the KZN Eastern Cape, for example. So these are the ones that are undocumented where we provide, like now the city went to Pain City, where we have got a high level of people who might be foreign nationals, documented and undocumented. So we treat them the same way how we have vaccinated the homeless with no documentation, where you rely on the people in that setting, like the homeless forum or the foreign and national kind of the platform forum, where they'll be able to indicate that this is Noma French Mbombo, who has been in South Africa for 15, whatever, 20 years, is undocumented and all of those. And then you have to keep that records so that when the time that the system opens, you still have got the records that they can populate. Although they might not be counted on the EVDS currently, but for us, it's part of the people that you be able to count as the people who have been vaccinated, because you are using those vaccines anyway. Thanks, Kay.
Thank you very much, Minister. And we'll now hand over to Dr. Klitty.
Thank you very much, Kayla. And just thank you to Arthur for the question. The moment the announcement is made for 18 to 34s that they can register and vaccinate, we have sufficient capacity at our sites to be able to respond. Our sites are actually prepared for it. And therefore, as I tried to explain in the slides, we currently have about 30,000 vaccinations per day. If this registration is open for that age group, we have the capacity to go to about 45, even to 50,000 vaccinations a day. So we believe that we are prepared for that. Thank you.
Thank you very much, Dr. Klitty. So we'll now move on to the next round of questions. The first question, which has come through, is from Shakira Tebes. Shakira is from Cape Argus. Her question to Dr. Klitty: there have been reports that people within the 18 to 34 age group are making use of the walk-in option and getting vaccinated. Is the department aware of such cases, and what is being done to address this? Which facilities is this being reported to? And then the next question that we have received is from Anele Mfazwe. Anele is from Dison, and he asks Minister Mbombo, can you elaborate on what kind of engagements you had with nightclub owners regarding vaccinations at their clubs? Also, what kind of agreements have you reached in this regard with owners of Rands at Khayelitsha? The next question is from Chego Lafula. Chego is from Weekend August, and his question also to Minister Mbombo or to Dr. Klitty. What are the challenges with regards to vaccination registration and administration in the central Karoo? Is it an issue of vastness of towns in the districts or access to health facilities? So for this round, I will firstly hand over to Dr. Klitty, and then I will hand over to Minister Mbombo.
Thank you very much for Sakina's question in relation to the 18 to 34-year-olds. We have, it has come to our attention that there has been 18 to 34-year-olds that have used the walk-in option and has been offered vaccination. We have specific instances where that happened, and the facilities where it did happen, people were using the manual capturing of 18 to 34-year-old, knowing that the system will be opening in a few days' time, and then for retrospective capture. We have specifically given an instruction that that practice must stop because we await the formal outcome from the announcement from the National Minister, and that people then are vaccinated in accordance with the EVDS number and system, which give them a code to be vaccinated against the vaccines. So according to us, that practice has discontinued, and there were isolated instances where it did happen, but we put a stop to it. In terms of the Central Karoo question, I think Minister Mbombo has already touched on it, and she will probably elaborate a little bit further. But it's a combination of vaccine hesitancy, in terms of very prominent community leaders having anti-vaccine stances in that community, as well as distance and access. So as he explained, Central Karoo itself might be small, but is vast in distance and small numbers of people, but there are different contexts and different realities that ultimately adds up to the low uptake and the low registration and uptake in the area. Thank you very much.
Thank you, Dr. Klitsi, and we'll hand over to Minister.
Yes, before I respond on the clubs, just to add again on Central Karoo, you get pockets also of people who are more conservative in regard to even morally and also religiously. I know this based on when we were signing more of the termination of pregnancy, stroke, abortion clinics for the uptake at the clinic level. We'll find that the resistance is not only from the users, health users, even also from the service providers, be it social workers, be it healthcare workers. And with the issue of the vaccines, you still have got people anecdotally, not necessarily that we have conducted a study, where they will talk about the issue about satanism around the vaccine and all of those. So that's why for us, it's about where we don't only focus on the over 60s, where it might be difficult, some of them, to convince them otherwise, so they are uninformed. But the excitement is about, anyway, the most people who are have high mobility, they move around, is also the youngish people, as Dr. Kuta has indicated, in terms of the distances. So when we're bringing the music track, attracting more in the Leo Gamka, which is in Prince Albert, and Better Fatar, which is in Prince Albert, and also, although there might be fewer people in the Merville, but the team is already mobilized at the Beaufort West around the hillside. So we will have to bring many of the different approaches around that aspect. Whereas in Laingsburg, which I've been there, it's about where actually there's a health literacy where they are just blank. It was about providing information, and then that's when now they could be able to weigh the pros and the cons, and to find that actually they were more open about it, and then the issue of the accessibility. In regard to the negotiations with the clubs, noting at this stage, we have no official pronouncement by the national, except at the time that they indicated they will be opening up for the 1st of September for the AMA bundles. I call them AMA bundles of joy, the 18th, the TikTok group. So it was during that time. So what is happening now, the team has been building towards that 1st of September. Firstly, you start where you have got access to. That's why I made an example of the Athlone, where it will attract those people. AMA bundles that also have got cars, because it will assist them in terms of the drive-through, but also because it is a non-health setting. As we know that with the young people, they prefer to go to the non-health settings because they don't want to be judged. They want to be cool about it, because they always assign or have a view about when you go to a health setting, it means that you are ill. They don't see the symptoms ill, which is similar, same methodology that also applied when in terms of the health-seeking behaviors in regard to the HIV and AIDS, and also uptake of the ARVs. For example, in addition to that, you get as many of the requests from as many people, not only from the clubs, even for the industry. Like I know that sometime, I'm not sure when is it, next week, I think so, where I'll be joining the Sea Harvest in Saldanha, although it's only for it's their workers, but they are opening up for any others for the adjacent communities, which, for example, it's where it's non-health, that's when it attracts other people. Same as with the Oceania in St. Helena's around the Saldanha, where they say they'll be open for anyone. For the clubs in Rand specifically, Tata Uluzuko Umchita, the owner there, for the rands. He was saying, for example, about now that with the lockdown restrictions, where you find that these places, they are not utilized, but you know that with the young people, they'll be looking forward to when it's open, fully fledged open, and they'll be jumping. So why don't that the first jump? The first jump for Joel must be where it's about actually you are going there to chill, to vaccinate, not necessary for the alcohol and whatever. So to make vaccination fashionable in regard that I got the jab where I normally chill, something like that. So I've given it to the team there from the CARES to the CARES team as part of the whole package of the negotiations, where I made an example that the city has offered the new way, which should be available in October. So for now, they are still also negotiating with all others around that. The other appetite is against a long street about where jabs before you jaw. That when you go now to those clubs, whether it's a Kuban and whatever, those long queues that we normally see. I know this because the last time when we went with the city and the National Health Minister Mkhize in regard to the health protocols that the environmental health practitioners assist in regard to ensuring that their bylaws are being maintained without that space. So already there it was about if any other time that we may want to use our settings so that our patrons they could be able to be attracted to in regard to their health, will be the first one to jump. Because there's no use where we will be hiding and applying things that are against the bylaws or they're not against, they're against health protocols because we want business. As yet, you'll find that it does have an impact on the health of those. Every business, they want their customers to live healthy. So that's why we find that everyone is open for their use. Actually, the churches, I forgot to mention the churches. They're saying that now that is also even youth, before youth comes in, as they indicated with the older persons, then we wouldn't mind actually just bring the bus and then we say that it's open for business, even the churches and the gatherings are open. Why don't we? And even with the funeral parlors, they're saying that actually they'll be even excited although we say 50 for the funeral. So when people come from the funeral, from the grave, or people coming, whatever of those, why don't they just use that opportunity and even jab them on the spot? So I think the excitement for the people of the Western Cape is that whilst we talk about the vaccine apathy and hesitancy, in some areas you don't see much demand, but there are many people who want to bring back things to normal. People are looking for the best summer, where at least they'll chillax and not being bothered about those. Last summer is when we were on total lockdown. People want, and with this, what we saw on TV in terms of the Europe Cup, soccer, and all others, what you see internationally, and also like in the rugby for the first time where we saw the Lions and whatever playing and there were no fans and all of those, people are saying that we want to go back to normal. We are here, Dala, whatever, you must just call us. So we are excited about that aspect. So that's why for us, we say we don't want only to go to those people who are saying call us. We want also to reach out those who don't hear the health illiteracy, who don't hear like the homeless, people who are very busy, like in the factories, especially the way they don't know have medical aids, to bring them. Like in Epping now, we're negotiating where we'll use our red dot bus tomorrow to bring some of them to go to the Grand West, which is Grand West is not ours. It's a private. And they're saying that we are open for everyone. We assisted them to put it up. Like in the sea harvest in Saldanha, like we did in the Distal, and also like with the clothing industry, workers, factories that already they've been opened up, as we did helping with the Department of Education with the social development. Thank you, Kyla.
Thank you very much, Minister. So we will now take our next round of questions. I see one question which has come through two questions which has come through over WhatsApp. I'll just give it a moment to see if there are any hands over the Microsoft Teams platform. I see no hands, so I'll move to WhatsApp. First question, which has come through, is from Aisha Ismail from ENTA. Her question to Dr. Kliti. Given the current situation, when can we expect the fourth wave to hit the Western Cape? And by when do we expect to achieve herd immunity? The next question is from Arthur from Heart FM. Arthur's question to Premier. Have you considered to approach the President to propose further relaxation of the country's lockdown restrictions? And we will now complete this round of questions. Just want to confirm no more hands. So I'll firstly hand over to Premier, and then I'll hand over to Dr. Kliti.
Thank you very much, and thanks, Arthur, for that question. No, I haven't as yet. As you've just seen now, we've been sitting at that peak now for a while. These are the first numbers we're seeing as that indication. I welcome those numbers, but we have our strategy session tomorrow, so that will also, enable us to review where we are and then whether we put that forward. What I do note is that we haven't had a PCC last week, so I presume there should be one pretty soon, but we'll make that decision probably after tomorrow in our COVID-19 strategy discussion. Thanks, Arthur.
Thank you, Premier, and to Dr. Kliti.
Thank you very much, Kayla. And then to the question of Aisha. Just to indicate, Aisha, that if you follow carefully what happened to the first wave, and then into the second wave, and then into the third wave, there is a seasonal pattern to it. And that is the predictive pattern actually globally of what is there. So if we follow what happened between our first and our second wave, we roughly have about a 2 to 3 month period in between waves, and then the start of a next wave. So if we predict from that, we expect that this wave that we are in now will tailor off till about mid-September, end of September. Then we'll have October, November as 2 months in between, and in all likelihood by December, mid-December, we will be seeing an upswing if that's the natural pattern of what happens. Now, a lot of things can happen between now and then. The first thing we're saying that needs to happen is if we have a maximum uptake of vaccination, especially in the people that's more vulnerable, it gives maximum protection against a fourth wave. Now, I'll come back to that term because all the scientists are moving to using the term rather than herd immunity, and are moving away and advising us to move away from the term herd immunity. And what do we know for maximum protection? We know from our third wave data that 68% of everybody that's admitted during this third wave are over the age of 50. We know that 87% of deaths due to COVID in the third wave is due to people over the age of 50. So it stands to reason, if we can get everybody over the age of 50 in this province vaccinated, fully vaccinated, by the time we reach early December, we have a maximum chance of reducing the impact on the healthcare system, because we would have fewer people needing to be hospitalized and fewer people going into an ICU or critical care that's at the risk of dying. And that for us is the big drive. It's protection and maximum protection in the age group above 50. It does not mean that people under the age of 50 is not at risk. They're just at smaller risk. So therefore, our priorities for vaccination has always been over 60, 50 to 59, and then 35 to 49, and then the 18 to 34-year-olds. And what that means is if you are vaccinated, your risk of being hospitalized and dying is being reduced significantly by the vaccine. But your risk of transmission or getting COVID is also reduced, but not completely taken away. So that is the message. If you're vaccinated, you may still contract COVID. That's why we say, even if you're fully vaccinated, you need to continue to mask up, you need to continue to have social distancing, and you need to continue to avoid gatherings when there is more COVID around, because your risk of getting COVID might have been reduced, but there's still a risk of contracting it. So the scientists are saying because that risk is still significant, you cannot talk about herd immunity because herd immunity presupposes that what you have as protection protects you from contracting the virus. I hope I've explained that sufficiently for Aisha. Thank you very much.
Thank you very much, Dr. Fletti. So we have no further questions which have come through. I will now hand over to Premier to make his closing remarks.
Thank you very much, Kayla. Thank you very much, Mr. Mbomba and Dr. Kluti, for once again open, transparent, showing exactly where we are as a province. Thank you very much to the media for attending and for your questions, and of course to those of you who join us through the social media platforms also for your engagement, your questions. We've got to continually make sure that we understand what's happening, how things are changing in this environment, and how we are slowly but surely beating COVID-19. I think my closing remarks would be, number one, I am really happy to see that it looks like those numbers are changing. That definitely helps us make a difference. It will, as Arthur's question was, are we able to actually call for a PCC to change the environment we're in from curfew times, etc.? Absolutely, as soon as those numbers start to come down. But it's still a partnership between government and its citizens, making sure that we keep flattening that curve and pushing it down as quickly as possible, number one. And number two, that we now really start engaging on mitigating risk of wave 4. And that means we've got to get the vaccine numbers up. And we've all got to play our part there as well. Looking forward to the announcement. Hopefully it comes today. And we then have a fully open system. We've played our part now in getting vaccine sites across the province. Dr. Kluti's just said now we've got supply at all of these sites. So now we need to make sure that we now are averting that fourth wave risk of lockdown, especially considering that it's, if it follows the patterns, it's going to come again at a season time in our province. And we need to make a holiday season time, a season time for the tourism market and making sure that we protect those jobs. So that's why it's an economic decision right now to go down, get registered and get your vaccine. So thank you very much once again for joining us and enjoy the rest of your day. Thank you.